we are going to be doing goniometry of the thoracolumbar spine. So the thorax and the lumbar spine in one. First, we are going to start with trunk flexion. One thing about trunk flexion is we are going to be doing one vertebrae at a time, and as soon as the hips move into an anterior pelvic tilt, we are going to be stopping because that is considered cheating. So, I'm going to place a cube in front of our patient just in case he loses his balance. Alright, so normal range of motion for thoracolumbar flexion is going to be 0 to 80 degrees. Our landmarks that we are going to be finding for this are the 12th rib, and then we are going to line our stationary arm with perpendicular to the floor, and then our moving arm is going to be in line with the mid-axillary area. Alright, so we're going to find rib 12. Hands down, please. Rib 12. Alrighty. So you can put your arms straight out at your sides, and you are going to perform thoracolumbar flexion, moving one vertebrae at a time until you no longer can go down. Go ahead. Alright. And back up. And now I'm going to take his measurement after watching his active range of motion for thoracolumbar flexion. So, remembering we are putting the fulcrum at the 12th rib. We are putting the stationary arm perpendicular to the floor. And then we are going to be using the moving arm as the mid-axillary area. Whenever you are ready, we are going to perform thoracolumbar flexion. Remember, we are using one vertebrae at a time. Alrighty. And our patient has performed 111 degrees of thoracolumbar flexion. Now we are going to be doing thoracolumbar extension. We are going to be using the same exact landmarks as before. For patients who are elderly or who have unbalanced balance issues, you can have them stabilize themselves with the table or just for safety purposes for every patient in general. So what we're going to do is the same thing. One by one, we're going to extend, and as soon as the hips move forward, that is considered cheating, so then we are going to stop. Arms out straight in front of you. We're going to find that 12th rib again and align our fulcrum with it. Perpendicular to the floor is our stationary arm, and then our moving arm is moving along with that mid-axillary area. Whenever you're ready, we are going to go backwards. That's all you got?
Yeah.
Okay. Alright, our patient has performed 30 degrees of thoracolumbar extension, which is over the normal range of motion value, which is 20 degrees. Next, we are going to be doing lateral side bending and then rotation of the thoracolumbar spine. For lateral side bending, we are going to be finding the S1 spinous process. Can you bend forward a little bit, please? Alrighty, and back up. Alrighty, our fulcrum is going to go at that S1 spinous process. Our stationary arm is going to be perpendicular to the floor, and our moving arm is going to be in line with C7 spinous process. Whenever you are ready, we are going to be sliding your right hand down your right thigh as far as you can laterally, like you are stuck in between two planes. And back up. And then now I'm going to take the motion after passively watching him move through the range of motion. So we're going to bend towards the right whenever you're ready. Alrighty, our patient has given us 29 degrees of right side flexion, and normal side flexion range of motion is going to be 35 degrees, so our patient is under normal range of motion. Now we are going to check the left side bending. So when you are ready, we're going to slide that left hand all the way down your left thigh. There we go. Back up. Try not to lean forward. We're just going to go strictly to the side. There we go. And back up. We're going to find those same landmarks as the right-hand side C7 spinous process for our moving arm, stationary arm perpendicular to the floor, and our fulcrum at the S1 spinous process. Whenever you are ready, we are going to do left lateral side bending. Alrighty, come back up. For left, our patient has shown 35 degrees of left side flexion, which is much more than the right-hand side. So this patient would need help strengthening and stabilizing his right lateral side bending of his thoracolumbar spine. For the last measurement, we're going to be doing thoracolumbar rotation. I'm going to be bringing my little stool out for my patient to sit down. Make sure that our patient, when we are measuring him, is going to be feet flat on the floor in an erect sitting position with arms across the chest. It's important for this measurement in order to be on top of the patient as much as possible so you are able to get proper measurements. What we're going to be doing for this motion is we are going to be simply keeping both of our sit bones, ischial tuberosities, on the cube. Once those are stabilized on the cube, we are going to simply rotate to one side and then rotate to the other side. There we go. Be sure to make sure that your patient is keeping both feet flat on the floor as well as both of those sit bones on the seated surface. The fulcrum is going to go in the apex of the head in the middle. Your stationary arm is going to be staying perpendicular to the line, the imaginary line between the acromion processes, and then the ASISs of your pelvis. And then the moving arm is going to stay in line with the imaginary line in between the acromions. So whenever you're ready, we're going to go to the right hand side. Alrighty. For that side, we got 55 degrees of range of motion. Normal range of motion is going to be 30 to 45 degrees, of course, starting at 0. Next, we are going to be going towards the left-hand side. Whenever you're ready. Alrighty. Make sure when you're measuring this, you're not measuring the cervical rotation. You are strictly looking, staying in between the line of the acromion processes on the shoulders. For our patient's lateral rotation to the right-hand side, he has given us 60 degrees of lateral rotation, which is, again, above the normal value for thoracolumbar rotation.